So what is a mole? Generally, they are benign tumors of the skin. You can be born with them. Most people will acquire new moles throughout their lives. It tapers off a little bit as you get older, but almost everyone has anywhere from 10 to hundreds of moles. Here at Donnelley Dermatology, patients often come to me when they don't like the appearance of a mole or if it's rubbing against something. The most common way we remove moles is a surgical treatment. It can be a very simple shave removal with a scalpel, just flush to the skin, or occasionally we cut the mole out and suture it. Very easy to do, done in the office under local anesthesia. The cosmetic result is usually excellent. This is where you see Donnelley Dermatology sort of combining the medical, the surgical, and the aesthetic. I also want to add that all moles that we surgically remove are sent to the pathologist to confirm that they are benign. Like moles, cysts are another common benign skin growth that patients come to see me to have removed. Cysts are essentially growths that arise out of a plugged up pore that sort of gets really inflamed, and sometimes that little hair follicle explodes. And due to the inflammation, the body creates a little sac to encapsulate that inflammation. If a cyst becomes an abscess, we have to drain the abscess first, calm down the inflammation and infection, and then once everything has calmed down, usually after a few months, we can go back and remove the underlying cyst that caused the problem in the first place. So why should you come to Donnelley Dermatology for your mole or cyst removal? One, I think I'm a very talented surgeon and I've removed thousands of these. Two, we have very transparent pricing. You will have pricing really based on the size of the lesion that needs to be removed and how much time it's going to take to remove, and often it will be less than you would have to pay under your insurance policy if you haven't met your deductible.